Well, good morning. We're here at Balanced Physical Therapy in Watsonville with Kurt Munoz. Kurt is an ambitious new turner along with his daughter, but he's also a doctor of physical therapy, and he brings a unique perspective to our discussion about ergonomics in wood turning. So, Kurt, we're going to talk about two things today. We're going to talk about how fatigue affects us when we're wood turning, and maybe more important, talk about the kinds of soreness and injuries that can be signs of something that needs more attention. So, how can you tell when you're getting tired?
It's a great question and a really important one, especially when working at a lathe with very fast moving objects. Some of the main things that we look for are soreness, and that can be anywhere from our hands all the way down to our toes. And then also some changes in the way we're turning and the quality of our turning, like catches, or the difficulty with certain tasks at the lathe that we normally would have a really good handle of.
Well, if you feel like you're getting tired, what should you do?
Best advice we can give you is take a break, rest, know when to just take a break, step away from the tool, and give yourself some time to recover.
Now, one of our founders, John Wells, is famous for saying, know when to stop. Sometimes that kind of good judgment isn't enough. Let's talk about the kinds of soreness that can be a sign of something more serious that needs more intervention.
Yeah. Another really important question, Wells, and one that we shouldn't take lightly. So soreness that persists or pain, even mild pain that persists for multiple days, and I usually use the time frame of 72 hours. If soreness or pain persists for more than 72 hours, we should start to be a little more concerned and start to consider contacting a healthcare provider.
Well, where would this pain be?
Right. This pain can be anywhere from your hands, wrist, shoulders, neck, all the way down literally to our toes. It can be in our knees, our hips. And if it's new or reoccurring, every time you step up to the lathe and you're turning a piece and it comes back, or again, if it doesn't go away after 72 hours, it's more concerning, and we should really consider seeking some feedback and assessment from a healthcare provider.
Well, shouldn't we just take some Advil?
That's a really important question, and one that quite simply is no. We don't always know what is going on. So getting evaluated by a healthcare professional, your primary care physician, or a professional that you have an established relationship who knows your body and your type a little bit better is more important. They'll give you a host of things to do, from exercises to the potential of medications.
What would you suggest to a turner who's starting to get frustrated that he or she can't do some things that they used to do? What can they do about that?
Yeah, some things that we can do are, one, make sure that we're not fatigued. Make sure that our setup, our workshop, our lathe, our environment is correctly positioned for them, and get lessons. Talk to our senior members of the club who are always willing to help. And I can speak from experience, everyone has been so willing to help. Lessons are invaluable, and they can help prevent as much as possible injuries, breakdown, and some of the things that we're talking about here today.
So, one of the things that seems to be part of these injuries that we talk about, they're called overuse injuries, where we do the same motion over and over and over again, and it wears on some of these vital structures. Are there things that you can do differently to reduce that?
Yes. One, make sure that your equipment is positioned correctly for you. Two, make sure that your technique is correct. And that's something that you'll see with Wells time and time again here in this presentation, is making sure that your technique is sound, keeping the tools close to your body, using the big, powerful muscles of our trunk, legs, rather than the littler ones in our wrist, shoulders, and extremities.
What's the worst thing that could happen if you have one of these injuries that just gets worse and worse and worse and keeps you from doing the things you want to do?
Yeah. there's a couple things that could happen. One, it's going to ultimately prevent you from doing the thing you love, and I think we're all here because we love turning. And so, if we cannot comfortably be at the lathe, we cannot do the thing we love. But it can cause quite literally injuries that won't go away and can affect other parts of your life. Sanding incorrectly, carpal tunnels can lead to numbness, tingling, and difficulty holding coffee cups, feeding, drinking, things like that. So we want to take all of these signs serious and making sure that we're getting early feedback, or minimizing the risk of these injuries sooner than later.
Sounds good.